We in the medical profession, we are bound to give the name of the disease. The problem is, majority of our training in school is we are mostly focused on treating the symptom, not the root cause. For example, if a patient comes to me and the complaint is, for example, hyperacidity, so it's almost automatic, as what we learn in school, that for hyperacidity we give antacid drugs, anti-acid drugs, or proton pump inhibitors, or drugs that will suppress the acidity. But in my search for higher levels of truth, I now focus more on teaching the patient or teaching the person with hyperacidity on how to reverse the disease by treating the root cause of their problem. Like, for example, for hyperacidity, what are the common root causes? It's mostly lack of water, too much acid foods like soft drinks, junk foods, meat, processed foods, fried foods, fast foods, and too much stress also, too much anger, too much bitterness. All of those things can lead to hyperacidity. Today, in my daily practice, I focus on advising the patient on how to deal with the root causes so that they won't end up taking a lot of symptomatic drugs for a long term. Because there's a problem if you take a lot of drugs for a long term. The problem with that is everybody knows already about side effects. We are now in the age of the internet. We are now in the information age. Open their computers and look at the internet, and they can Google their problems. They can also Google the drugs that they were given. Another example is, for example, a patient comes to me with hypertension and then with a very high blood pressure. What I learned in my school is, I give all these antihypertensive drugs, and then I tell my patient, take that drug for the rest of your life. But only to find out, years after, then we look at the patient, then I started them before with one drug, and then years after, they have 3 drugs, they have 5 drugs. I have seen these patients, and rather than being free from the drug and being free from the disease, they get to have more drugs as years go by, and the disease continues. So, in fact, one of my patients told me, Doc, you're correct, because, some time ago, 15, 20 years ago, I started on one drug, and then 5 years after, I was on 2 drugs, and then 15, 20 years after, I was on more drugs, and the disease is still there. For example, if I give a drug for hypertension, the blood pressure goes down. But tomorrow, the truth will come out. It will still be hypertension. And then the next day, we give a drug again, it goes down. Then after a few weeks, it goes back up again. So the cycle, continues. It repeats itself until, the patient will be taking too many drugs, and the disease will become more complicated. So that's the problem if the main approach of the treatment is mostly on treating the symptom. But if the main approach of the system is mostly on treating the root cause, then there is a chance, there is a possibility, especially if the patient will commit himself or herself towards health, towards his or her health freedom, then they can put themselves in a path, in a journey that they can reverse their conditions.